I'd like to show you another great result with Invisalign First for early interceptive treatment. This is a 9-year-old boy. He still is in the mixed dentition where he has 3 baby teeth per quadrant. I'll show you the bottom in a second. You can notice the crowding. Now, when you have teeth that are crowded at this age, it's only going to be more of an issue when larger teeth replace these around age 10 and a half, 11, 11 and a half. So that's one reason we like to make space in this situation. And the traditional appliance for this has been a palate expander. Let me show you the lower teeth. You can see the lower crowding, and the lower crowding is even more advanced. This tooth was able to sort of find its way in, but you can see how rotated. This is a definite trap for plaque, bacteria, possible cavities. So this is an extensive amount of crowding at this age. And so we decided to do an early treatment. And the early treatment we chose was Invisalign. And the benefits of that are it's removable. It is much easier to eat, of course, removing it, than an expander, which does affect speech, is uncomfortable. But also, even though there's crowding here, the initial width of the upper arch for this patient was not incredibly narrow. So the fixed expander is very robust because it gives a true skeletal expansion, but not all cases need that. The problem is that so many pedodontists and orthodontists see crowding and immediately jump to expander. And by that, generally, it's a fixed expander. But here, we used aligners to broaden the arch. And here you can see, after 36 weeks only, how much nicer the alignment looks, which is almost the secondary reason for treatment. The real reason is to make more room in the mouth so that the other teeth will be able to come into better position. Most phase 1 treatments do still require additional treatment when these new teeth come in, and that might very well be Invisalign again. The lower teeth started out quite crowded, and this is astounding that this tooth turned not quite all the way, but almost all the way, and it all happened simultaneously. It's very hard to put braces on lower teeth with the primary teeth in place. In fact, most phase 1s are restricted to the upper arch. And so now the patient has really nice alignment in both arches, and the depth of the bite is even improved. Look at how the height discrepancy of the laterals and the centrals has improved. Not perfect, but definitely better. And we still have the ability with 10 more aligners to improve on this result. This case was meant for Invisalign First. It simultaneously expands and aligns the teeth, and it does it painlessly, invisibly, no effect on speech, eating. The expander gets pretty nasty. A lot of stuff gets stuck up there. Parents don't have to turn anything. It just is great for moderate to severe crowding when the constricted palate is not severely constricted. I should add that Invisalign has just come out with its own expander, which will hopefully give more of a skeletal expansion than the Invisalign First. But again, not all cases need that. This case did not need skeletal expansion. It needed dental expansion. Really happy with how this turned out.